Hello, and welcome to the Dental Learning Center. This is your hostess, Dr. Marie Huggy. Our very special guests today are the eminent periodontist, Dr. Elmer Stickfigure, and his privileged sidekick, Dr. Homer Goon. Welcome, sirs.
Good morning, Marie. I'm glad to be here.
Hello, Marie. Did you bring along the banana creme pie?
No, Dr. Stickfigure objects to messy eaters. Dr. Stickfigure, I understand your hobby is motivational speaking. Perhaps you can bring some of that to the discussion today.
Oh, I insist, Marie. These simple things can help bring perfection into one's life, isn't that right, Dr. Goon?
Excellence in dentistry, Dr. Stickfigure, excellence in dentistry.
Today we have an interesting case. We have a patient whose chief complaint is missing teeth. Some of the pertinent findings are listed. Our clinical examination reveals the patient is missing all of her maxillary posterior teeth. The remaining teeth show a reduction in clinical crown height of roughly 1/3 due to attrition. The periodontal prognosis is guarded for these teeth. The mandibular dentition is intact. The patient is concerned about her appearance, and is unhappy with the aesthetics of the maxillary teeth. There are older stained composite resin restorations in the distal aspect of tooth number 7 and 10. We have examined the cast with the dental surveyor for potential paths of insertion for a removable partial denture. There are no bony defects, undercuts or frenal attachments which would preclude the use of clasps. The patient is willing and able to pay for dental treatment. When asked to close, the patient exhibits an end-to-end occlusion.
Marie, it's important to examine the patient in the retruded position. The edge-to-edge relationship may simply be an acquired position due to the loss of posterior support.
Right, your Dr. Goon. When asked to bite on her back teeth, the patient closes with contact very close to the palatal gingiva.
To begin, it will be necessary to restore the patient's vertical dimension of occlusion with an occlusal therapy appliance. The appliance will provide freedom from the centric relation position into a comfortable anterior acquired position. Anterior disocclusion will be provided with the acrylic splint.
This will test the patient's ability to tolerate a new vertical dimension as well as her tolerance for a removable appliance.
Excellence in dentistry, Marie.
Okay, Dr. Goon, let us say the patient wears this appliance, is compliant, and experiences no untoward effects.
Marie, preparations will be completed, teeth 7 and 10 will be removed. A 6-unit acrylic provisional restoration will be constructed. Socket preservation procedures for 7 and 10 will also be completed.
Excuse me, Dr. Goon. Why extract the lateral incisors?
Well, Marie, these teeth have large restorations, and incorporating them into the splint complicates matters. They don't contribute that much to the strength of the restoration, and complicate oral hygiene.
Okay.
Subsequently, a clasp-retained acrylic provisional removable partial denture will be fabricated at the proposed dimension of occlusion.
Dr. Goon, after a period of time, the extraction sockets are healed and the patient is ready for the definitive porcelain fused to metal restoration. The acrylic provisional removable prosthesis is adjusted as necessary. The anterior provisional fixed partial denture has been evaluated for fit, aesthetics, and occlusion. These factors, as well as Dr. Stickfigure's suggestions for making every day perfect, have been accomplished.
Yes, Marie, you know, I grovel at the feet of Dr. Stickfigure. Now, the 6-unit fixed partial denture with semi-precision attachments may be fabricated and placed.
Yes, Dr. Goon, the patient has indicated her approval and subsequently a definitive cast metal partial denture will be inserted.
It is important to maintain a recall schedule for this patient, primarily to ensure that her desk is free from clutter.
Right, your Dr. Stickfigure. This is one proposed solution to this particular case. Other options may be considered, such as an implant-supported restoration, a longer-term or acrylic partial, a complete maxillary denture, or simply maintenance and recall. I'd like to thank our guests, Dr. Stickfigure and his groveling sidekick, Dr. Goon, for being with us. So from the Dental Learning Center, this is Dr. Marie Huggy, hoping the rest of your life is perfect. Thank you. Gee Marty, where'd you find those two psychos?
Well, the state has cut our funding. They were the best we could afford.
Well, at least I didn't have to suffer Dr. Goon's horrible table manners.